Hey everybody, Ed Bowder from the Med School Medic Podcast, medschoolmedic.com, here with a 5-minute EMS refresher, and today we're going to talk about difficult airway assessments. Now, when you're going into a patient that you think you might have to intubate or that you even have any high level of concern that they might need airway management, you want to consider whether or not their airway is going to be difficult to manage or easy to manage. And the way we're going to do that is there's a couple different methods. Specifically, we're going to look at the MOANS score, your Lemon score, and your Mallampati and Cormack-Lehane score. So when you're looking at your patient as to whether their airway will be difficult to manage, the first thing we want to do is we want to see if we can manage their airway through BLS skills. So we'll have a nasal pharyngeal airway, an oral pharyngeal airway, and a bag valve mask that you see above. So the first thing we want to look at is, can we obtain a good mask seal? And that's the M in MOANS. So we want to see that their external facial structures allow us to actually put the mask on the patient's face and hold it down so that when we actually squeeze the bag, no air escapes out of the side of the mask. The next thing we want to see is whether the patient is obese. Now, again, that's the O in MOANS. The obesity issue, if the patient's face is just simply too large, or if their facial anatomy is just too disproportionate for the bag, that's something we're going to have to address, and we'll get to that later in the Lemon score as well. We have to consider if the patient is aged over the 55 years, and that's just because of the different airway anatomy changes that happen over the years. And you may also be concerned if the patient has dentures or things like that, just something to consider. And that's where we get to the N in MOANS, which is no teeth. A patient having no teeth is almost worse than a patient who has dentures. If a patient has no teeth, it's very difficult to keep that rigid structure that keeps their airway open. And when you bag them, it's very difficult to get the air into their mouth. And then the last thing we want to look at is whether their face or neck is stiff. Now, again, if you're in a situation where you have a patient who has trismus, where their jaw has been clenched and you can't open their mouth to actually deliver the air, we're not going to get any oxygen into them. So after you pass through the MOANS score, you're going to want to look at what's called the Lemon score. Now, the Lemon score pertains to intubation. So if you're a paramedic or a nurse and you actually want to, or a physician, PA, and you actually want to pass an endotracheal tube into this patient, these are the things you want to look at. So the first thing you want to do is you want to look externally. Going back to the MOANS score, do they have anything externally that tells me this is going to be a difficult intubation? And that's the things that you want to look at, again, getting back to MOANS. After we look externally at the patient, we want to evaluate the 332. Now, 332 pertains to the airway structures in the patient. So you want to consider the patient's fingers, not yours, and we want to see the opening of their airway, 3 fingers. Then we want to see the 3 fingers from the chin to the hyoid bone, and then we want to see 2 fingers from the hyoid down to the cricoid cartilage, which sits right above the vocal cords. So if they pass the 332, then you're going to evaluate their Mallampati score. Now, the Mallampati score affects how we can actually see the uvula in the back of the throat. We'll talk about that more in a second. After we get through the Mallampati, we're going to look at obstruction or obesity. Now, the obesity thing we already addressed with the MOANS score. The obstruction, we want to see if they have any upper airway obstruction, and it could be a lodged food bolus or any other type of thing that is just blocking that airway that's going to make our intubation more difficult. And the last thing to look at is neck mobility. If we're in a situation where the patient's neck is just too stiff, whether we've immobilized them from trauma, or if they have some type of cervical spine injury, that's something we have to consider. It's going to make the intubation a lot more difficult. Now, the Mallampati-Cormack-Lehane score, there's a direct correlation between the two of them, and the grade depends on the visibility you have either of the back of the patient's throat or on the vocal cords. So if you're looking at the patient's airway and you see you've got a good view of the uvula, the hard palate, the soft palate, and the tonsillar pillars, that's going to be someone who's a Mallampati 1. Now, the Mallampati 1 tends to correlate to a Cormack-Lehane 1, which you can see on the bottom there, is you have a full view of the vocal cords, right? And that kind of progresses along to class 2, class 3, and class 4. Class 4 is someone where you can just see the hard palate. You can't see their uvula, you can't see the tonsillar pillars, and then once you actually get the laryngoscope to the back of their throat, when you look, all you see is the epiglottis. You don't actually see any vocal cords. So that's someone who's going to be a very difficult airway. So that's what we have to look at when we're looking at our difficult airway assessment. My name is Ed Bowder from the Med School Medic Podcast, medschoolmedic.com. Be sure to check us out on all the social media listed above. Subscribe to iTunes, Google Play, Stitcher. We'll see you next time.